Assalamualaikum and hello everybody. Welcome again to the second CME Met Tweet My session. We have a very important topic this evening, which is burnout among youth. Our speaker for Dr. Ahmad Rostam, consultant liaison psychiatrist, hospital student of Rostam. Our two guests are junior doctors, Dr. Muhammad Saharuddin, medical officer, and Dr. Abdul Jamaluddin, a house officer. So, I would like to our initiative for medical fraternity, and we focus on core skills that is relevant to daily medical practice. We would like to extend our heartiest appreciation to Department of Medical Education for collaborating with us for the promotion of this event. My name is Hafsa Sazali. I'm the chairperson of CME, and our co-chairs are Dr. Iskandar Mirza and Dr. Norman, Dr. Rafida, Dr. Nurul Yakin, Dr. Anwar Fazal, Mr. Zainal. Any ideas for content, or you're interested to collaborate with us for educational events, feel free to contact any of us. So let's get started on our topic today, which is burnout among junior doctors. I would like to hand over the session, hand over the platform to Dr. Rafida.
Thank you so much, Hafsa. Assalamualaikum, everybody. I do think I'm going to take too much of your time. Let's welcome the first speaker, who is Dr. Abdul Halim Hazwan Jamaluddin, a house officer currently working in Hospital Sultan Haji Ahmad Shah Temerloh, to tell his side of the story and his experience. Dr. Abdul Halim.
Okay, thank you, Dr. Rafida. So, Assalamualaikum and good evening, everyone. My name is Abdul Halim Hazwan Jamaluddin, currently a house officer in Hoshas, Temerloh. So before I begin, I want to first express my gratitude, how fortunate I am to be here, because normally as house officers don't really get our voices being placed at the forefront of any issues. Normally, you see us venting our problems, expressing our views, normally in Twitter Jaya, in Facebook, around the peripheries. So for MedTweet.my to be providing us such platforms to give our opinions regarding what's happening at the forefront of medical healthcare is very important to us. So I try my best to represent our views, even though I'm just working in a particular hospital in a particular state. I hope what I share today will shed some light on how we are actually coping with our healthcare system right now. So first, I would like to begin my sharing with just one statement. Burnout is real. It is not a myth. It is not something that people say to get off work. It's not something that people use to actually abolish themselves from any responsibilities. No, it is. I could even say that burnout is an occupational hazard for those who are going to be a medical practitioner. I think Dr. Rostam will elaborate more regarding from ICD-10 or WHO specification what it means to have burnout. But it's basically what you experience as exhaustion secondary to excessive stress from work. Normally, you will hear and see junior doctors say or share in their Facebook, Twitter, or any kind of medium regarding about being a zombie, not feeling alive, not really feeling it while they are being housemen. So, what is it? Burnout. What is it actually? If you are to be precise, just 3 criteria. When you have these 3 criteria, it can be said you have burnout. You can have it simultaneously or one time or another. First would be exhaustion. Regardless, is it physical? Is it emotional? Is it mental? When you feel down, you feel do not have the energy to go forward, that's first, this exhaustion. Secondly, you feel detached. You are not present in what you are doing. This is what meant by being a zombie. You go to work, you punch in, you punch out, and you don't really realize what's been happening for the past 12 hours you'll be in hospital. And that, I think, would be the most dangerous thing to have burnout. We have exhaustion. When you're exhausted, you feel detached from your work. And finally, you will tend to have mistakes. what you are feeling right now will affect your performance in your occupation, which I believe in our profession is a very fatal mistake. So what do I know about burnout? Personally, I won't say that I have experienced all of those three conditions simultaneously. However, by the virtue of being a houseman, you'll be having one or two symptoms along your career. For example, you've been working 3 night shifts consecutively. So tomorrow morning, you'll be saying that, lantak lah, I don't care, I just want the day to finish. I punch in, I do my work, I punch out. But, however, I have seen people, my colleagues, particularly the juniors and seniors, regardless of who they are, whether you are the best student in your university years or you're just beginning your houseman life. Now people are able to actually cope with the burden of being a houseman. An example, currently there's a colleague of mine, currently in my posting. She just started her housemanship about 3 months. Initially, about 2 weeks in, she was fine. And then suddenly, there's consecutively taking of MCs and elective emergency leaves. Yeah. She may seem fine. She talks fine with you during work. You see her being able to converse with the patients well. However, after some time, she'll disappear. That is secondary to burnout actually. And it is not limited only to junior doctors. Even our seniors, I won't be touching on MOs because I believe Dr. Ashraf Sairuddin will be speaking more on that. In our setting right now, I think last month, there was a case whereby a patient in certain department was known to be COVID positive after 2 weeks being in the department. What happened? The particular ward was shut down. And what happened was that there was allocations of workforce. Some people have to be quarantined at home to cover everything. What happened? For the consecutively 96 hours, they were forced to work. The housemate is already burdened enough. And currently in our setting, whereby we have COVID, what you call outbreaks in our country, it only worsens the condition. 96 hours, and we had to actually provide emergency, what you call psychosocial, psychiatric first aid to this particular houseman. You'll see them bickering in their Facebook posts, WhatsApp posts, how they need so much support. And one particular thing I want to add before I end, because I think I'll be only sharing just a small snippet regarding burnout, is that I see there's very little show of kindness among our fraternity, regardless whether you are a houseman, medical officer, or specialist. When we have a colleague or a junior who is having burnout, what do I mean by that? We know the symptoms. We know what it is. We know it is prevalent. However, when we have a friend or the junior who is having burnout, we always do not give the benefit of the doubt. This is very concerning. We tell people that we must be kind to the patients, give attention, give care. However, when we are speaking with our colleagues, our demeanor changes. We demand so much from our friends because, of course, we demand so much from ourselves that we deny them their right to rest or deny them the right to actually treat themselves to a period of rest from being burnt out. So I think that's all I can share. I just hope that burnout among junior doctors is something that we really try to understand and appreciate. Of course, you won't be hearing us creating much commotion because right now, as us officers, we don't really have much at stake. No, we don't really have much value in our system right now. We are just I won't say disposable, but we're not so much valued. So please appreciate that we do have burnout is real and be kind. Mainly among us fraternity, among the fraternity, among our colleagues, the seniors or juniors. That's all I can say. I pass back the mic to Dr. Rafida.
Thank you so much, Halim. That's very touching. I think thank you for having joining us. You know, your voices. You know, even as a houseman is very very useful. I mean, we need to know what you feel, obviously. So I think let's move on. And the next person I'm going to call upon is Dr. Muhammad Ashraf Saharuddin. He's a medical officer currently working in Hospital Putrajaya. Let him tell his side of the story. Ashraf.
Assalamualaikum warahmatullahi wabarakatuh and good evening. Thank you to Dr. Rafida. Thank you to the rest of the moderators. Also thank you to MedTweet.my for having me and Halim as a guest for this evening CME. I hope my voice is clear. Okay, so I am Ashraf Saharuddin, a medical officer in Hospital Putrajaya. I think first I would like to express my total agreement with some part of the points that presented by Halim. I think I agree that we cannot downplay the symptoms of burnout. The moment someone actually complain about being fatigued, about being lethargic, about being no interest to work, then the listening ears must be pay more attention and try to help the colleague who is complaining. So I believe I myself don't have any full-blown burnout. Okay. But I do have experience. I happen to know somebody with full-blown burnout that eventually end up with having a psychiatric diagnosis. So I believe burnout is more a spectrum. From one end, you have all this emotional exhaustion, and from at the another end, you have all these full-blown symptoms that can actually fulfill some of the psychiatric diagnosis. For example, adjustment disorder or up to MDD, major depressive disorder. So just to share a story regarding this colleague of mine that I know about the case, that he eventually, he was a very committed health officer, but then the day before he totally functioning. Okay, the day before, it's just that one day he just burned out. He just totally non-functional. Okay, he didn't come to work, and there is even repetitive thought of death. Right, it's up to suicidal ideation. So there is wish to die. So this is very alarming. This is like a warning sign. The moment I heard that, we immediately arranged for psychiatric referral. Okay, but then actually it's just really a burnout. Okay, although it is very it resolving by itself maybe after rest about 2 weeks, but then the complication, I mean the complication, not really clinical complication, but the administrative complication, in the sense when this fella able to finish the housemanship, and there is actually hurdles regarding the application for the MMC. So there's a bit of delay regarding that. And probably what I would like to comment is, for the system itself, probably there will be a better referral, probably not straight to the psychiatry, probably to psychologist first. And then that would probably much better rather than straight to psychiatry assessment, because apparently there is a real hurdle or a real complication to the career of a house officer. Okay, and then I think first of all, I think just by being a doctor, okay, just by being a doctor, we have actually twice the risk to develop burnout symptoms. There is a study in the US by Schnefeld and his colleague, when they found out that the prevalence of burnout symptoms among the physicians in the US is 45.5% in 2011. This is in 2011, and the prevalence is 45.5%. Like, it's just like one of two physicians in the United States is having burnout symptoms. And the prevalence actually increased in just 3 years, by which in 2014, the prevalence of burnout among the physicians in the US increased by 9%, from 45.5% up to 54.4%. And this is actually a very significant increment. So what happened in 2011 to 2014, definitely there's no pandemic. There's no Donald Trump as well. So I believe if you want to know what's the prevalence of the burnout symptoms in the US currently, I think the good guess, it is probably much higher than 54.4%. Also, our local study showed the prevalence higher among among junior house officers, particularly those in first and second poster, because the study in the involving about more than 100 house officers, they found out that there is 1 in 5 house officer in PPUM actually had burnout symptoms. And the prevalence is much higher among those first and second posters, and also those housemen in emergency department. So I think just by being a healthcare worker, the risk of developing burnout symptom is there. It's twice compared to general population. For example, in the US, the prevalence among general population is around 28%, and it is quite constant throughout the years. So today's topic is actually about junior doctors. Okay, I think burnout symptoms happen to everyone, be it senior doctors, be it junior doctors. So how about the junior doctors? What is so special? What's so unique about junior doctors that we actually bother to talk about this evening? All right. So in terms of pandemic, COVID-19, okay, I think it affects everyone in one way or another. Somebody just happened to get infected by COVID-19, but the majority is affected economically and also financially. And then in hospital setting, for example, both senior doctors, I think I want to narrow down to medical officers. Both senior medical officers and junior medical officers are working together side by side to combat, to treat patient with COVID-19, to treat patient, surgery patient, and treat other patient, medically or surgical case or medical case. So there is the senior medical officers are not spared from this burden in healthcare delivery. So what is so special about junior doctors then? And who is these junior doctors? So basically, I think junior doctors are those juniors medical officers and also the house officers. And what's the common trait between these two is actually the contract. They are contract medical officers. And just by having this contract officer, I think this is one independent risk factor for us to develop burnout symptoms. You don't need COVID-19, you don't need anything else. Just keep us in this contract system. It is enough for us to have burnout. Okay, I think I'm sorry to say this. I'm being honest here, because if you talk about burnout symptoms, I think everyone is having it. Okay, there is no we cannot deny this. Even the consultant, the head of department, pengarah hospital pun dapat. Okay, senior medical officer pun dapat, because the burden is the same. Okay, the senior medical officer need to work extra hours, need to do extra on calls. Like for Sari Ward in Putrajaya, we need to do 8 on calls per month. This is just the same with the junior medical officer. There is no difference. The only thing different is, while we are doing the same job, for the senior medical officers, or I would say permanent medical officers, they got one thing extra in their hand, their job. All right. Meanwhile, for the junior medical officers, we are counting our days in the service. There is no guarantee that we're going to have a job in the next 2 years. So this is basically very stressful, particularly to the junior medical officers. All right. Because we are talking about junior medical officers, that I think I would like to highlight this point of view. So I think it's quite common. I think I noted there is many medical students here who are joining us. Thank you for joining us today. I think we know already there's a long waiting period for medical graduates to be absorbed into service for housemanship. Okay, a lot of them are doing Grab, a lot of them are doing Food Panda. Okay, delivering food, being a driver. Okay, I just hope we don't see a driver of Grab or Food Panda rider with full MMC. And it's just that my little hope. It's just a waste of talent after the government spend hundreds of millions locally, and it can be up to millions if the student had it, obviously, just to produce one doctor. But then we end up being I don't know, a person in other industries. So it's just a waste. So really, yes, I would like to echo what Halim has said. It is important to highlight the issue, and it is important to know that burnout symptoms can happen to anyone, be it you are seniors, be it you juniors, be it you medical student, or you just don't, even a doctor. Probably a medical student had their own account of being of having burnout symptoms. So I think that's what I want to highlight. Okay, at the moment, the detail about the burnout symptom, I believe Dr. Rostam will give us all the details regarding the symptoms, regarding the diagnosis, regarding the way to deal with it.
Yeah.
Thank you.
Thank you so much, Ashraf, for the straight from the heart words, and I hope, I always pray and hope that everything will turn out fine for everyone. So I think without further ado, I'm gonna invite Dr. Ahmad Rostam Muhammad Zain. A lot of us, he doesn't need introduction for, and he is at the moment working as a psychiatrist, Liaison Psychiatrist, Consultation Psychiatrist in Hospital Sultanah Bahia Al-Usta. Dr. Rostam.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Thank you, Dr. Rafida, for the introduction. Thank you to my team for this very important CME for everyone. Thank you to everyone for having me today, in which I would like to share with you something very interesting. I think both of our doctors just now has been sharing about the possible symptoms of burnout. There's a mixture of lots of different kind of emotion they're telling there, in which maybe many of you outside there are confused whether are they talking about burnout, are they talking about stress, are they talking about anxiety, depression, panic, or whatever it is. So, but the most important thing is actually what they are having is actually real. No one can say that it's actually something that they made of. No one can say that it's not important. No one can say that that should not be something that can should be highlighted in our profession, because we know that every single one of us is very important. But I would like to echo certain words that one of our speaker talked just now. I would say that everyone here, including me, including the senior ones, we are all not indispensable. We are not indispensable. Despite whatever experience that we have, we are not indispensable. So I would say that bear that in mind, so we will not be too, I would say, too depressed if, let's say, something happened to us. That's the first thing. It has been 17 years since I've graduated from UKM. I've been working in 8 different hospitals and attached to 5 other different hospitals. Of course, I've lots of stories about burnout. But I would like to share one very interesting particular story about one of my dear friend. It is a couple. The wife is actually working in the north states of Malaysia, while the husband is working in the south states of Malaysia. They are not staying together at that point of time for at least 5 to 7 years because of the commitment to master, commitment to different postings and everything. One fine day, at the end of the year, the wife got the letter to be posted to Sarawak for her gazettement as one of the new specialists. And she was in the 2nd trimester of pregnancy of her 4th child. I think 4th or 5th child. And then at the same time, the husband is actually doing a fellowship in the Southern Hospital in Malaysia. So what happened was, to put the story more interesting, one of their child is actually going to be on the first day of his standard 1 in school. So apparently she need to report herself to the new states on the very first day of school of her standard 1 boy. And unfortunately, the husband that's supposed to come back cannot come back, because you know why? Because at that point of time, you know, December and January is very busy time in which most of us is taking leave. So he was actually scheduled for on-call. He tried in vain to get someone to replace him, but unfortunately no one can replace him, obviously, because he did not ask for he did not request earlier, and he did not he never thought that the wife will be sent that fast on the first day of school. So what happened was this guy, he suffered through it because he was so sad because the wife went to Sarawak alone, heavily pregnant. The son went to school with one of his distant relative because both of them is not there. And he was in this hospital doing calls 7 days because he has a strict calls, 7 days call. And he felt that no one cared about him. He feels disillusioned. He feels so in disdain. He feels so depressed. He feels that no one cares. And he just lost his voice. Literally, he lost his voice for 2 weeks because he feels that he has lots of anger inside that he cannot put it out. He cannot vent it out. So what happened? He lost his voice for 2 weeks and he cannot speak at all for 2 weeks. That's very easy. He has a hoarseness of voice for 2 weeks. And he said that he suffered through almost 2 months before he can really recover. What he experienced back then was a typical symptoms of burnout, in which he said that he feel there's nothing important in working anymore. There's no joy in the work. He don't care anything about the job anymore. He just want to have a rest. He got angry easily with any referral that he gets. He become very impatient, very cynical, and also he said that there are parts of him that there are an occasion in which he show less empathy towards the patient, and this is actually the symptoms of burnout. Burnout is an illness of passion, guys. Burnout is an illness of passion because most of us here, whether you are medical school, you are junior doctors, houseman, MO, master student, specialist, consultant, we are passionate beings. We are passionate in this profession. We want to be in this profession. We want to be the best in this profession. We are idealistic. We want to do everything that we could do as someone that we think we can do better for the countries. And unfortunately or fortunately, what happens actually, not everything is actually based on what we think we can do, because idealistic is not something realistic. And in this situation, what I can learn from my dear friend is actually, in this profession, regardless of where you are working, we need to be realistic about ourselves, because no one, I repeat, no one will care about ourselves except ourselves and the one that loves us. That's very important. So before I go any further, I would like to put you into a context, because this for the past one year and a half, we have this very interesting events in which we are into this pandemic COVID-19. And I would say that when we are talking about burnout, stress and everything, we must know the perspective and the context. Because for us, the psychiatrists, we must know the context of a story. We must know the perspective of a person before we can really talk about what they are having, before we can really formulate what are you feeling about the situation. So in our context now, from our main perspective now, we are in the same boat, in which actually we are in a COVID-19 boat. And if you notice my graph there, we notice that there is one very up trajectory in which there it puts as impact at the first outbreak, and then we were called as a hero in Malaysia. Do you remember that? We were called as a hero in Malaysia. And there are lots of t-shirts talking about the heroes of Malaysia, the doctors, the paramedics. Everyone is a heroes in Malaysia. And we have lots of bantuan from everywhere. Everyone give a food, free food, McDonald's food, KFC food. All the fast food is coming into the hospital. Everyone get free meals every day. And we have a complete honeymoon around maybe 7 or 8 months ago. And suddenly, the third wave comes into Malaysia, and what happened because is actually every single one of us, including the Malaysian people, become disillusioned, and people become angry, including towards us, and we ourselves are already tired of this. We are already tired of this. We are so bored of doing this again and again. We are bored of telling people to change. We are bored of telling people to follow the SOP. We are angry with lots of things. We feel we are not appreciated because we are now at the point where we become disillusioned with the situation. This is the context that we have now. This is the perspective that we have now. And I would say that every single one of us, especially the juniors, right? I would say that our juniors that just working maybe 1, 2, 3, 4, or 5 years, maybe you don't really have the period of normality in a medical profession like many of us here. So that's why the context is very important. And adding on the issue with the contracts, adding on with the issue of the bullies, adding on with the issue of stigma to the junior doctors, everything is actually just accumulated and makes things worse. So what is actually burnout? When we talk about burnout, it actually has three components. Yeah? The first one is actually the personalization. This is actually very important study by Maslach, bukan masalah. Maslach burnout inventory is actually screening tools in which they screen three major symptoms of burnout. Number one, depersonalization is actually psychological withdrawal from relationship, because burnout is a problem of interpersonal communication. Burnout is a symptoms of interpersonal relationship. That's the most important thing about burnout. Burnout is not about an individual. Burnout is actually about connection. So that's why we feel disillusioned with all these things. So in the psychological withdrawal, they show symptoms of negativity. They become cynical and they become callous. They show callous attitudes towards their colleague, their juniors, their seniors, and everyone around them, including the patients. So the second component of burnout symptom is actually emotional exhaustion. And it's actually a chronic state of physical and emotional depletion that result from excessive jobs and or personal demands and continuous stress. I would like to highlight the personal demands because most of us is actually quite has a perfectionistic kind of personality trait, number one. And many of us is actually a type A personality. So this kind of personality is actually more prone to get burnt out compared with the type B or any other personality. So that's why I would like to highlight the personal demands as one of the risk factor for having burnout. Aside from that, other kind of personality, including anxiety personality trait, can also cause this kind of problems. So the third component of burnout is actually the reduced personal accomplishment. Usually what they feel is actually they are not being able to do better than the last year. Because as I said just now, it is an illness of the passion, it's illness of passion. Most of us is very passionate, but when we are not able to do as good as the year before, we become depressed with that because we think that we are not doing enough. That's the problem. The main difference between stress and burnout is actually when we are talking about stress, we are talking about overwhelmed feelings. We are talking about too much. But when we are talking about burnout, we are talking about not enough, different. So I will talk about a bit more about what is the difference between burnout and stress later. So what are the risk factors for burnout? Obviously, this is something that can be a perception of a person. It can be a different. It can show in the different perspective of a group of people, and at the same time, it can be. It cannot be shared. It can be not be shared by others, even in the same department. Few of the things that we can think of, even I think this echoes what our junior doctors is talking just now. It's actually number one is actually insufficient reward. Insufficient reward in whatever ways cause us to feel unappreciated. That's one of the main problem with the interpersonal relationship between us and the administrator or the government or anyone above us. The insufficient reward that we get. Few of the main complaint when we do the PFA for my Hospital Sunabaya Alostar, what we get is actually they just want the boss to say thank you. They just want the boss to smile. They just want the boss to ask, "Are you okay?" These are the three things that they want. But even these three simple things cannot be done by the seniors. So that's why they feel unappreciated. And then of course lack of control. In terms of they think that lots of things is actually beyond them, and they cannot do it. And then they feel that there are lots of work to do. They have lots of conflict, especially in terms of their values and the other people's values. I'm not having COVID now. Just kata tekak. they feel unfairly treated by anyone, including sometimes by their paramedics. And of course, the community breakdown, I would say that a fractured communication between the juniors, the seniors, the immediate seniors, the pakars and HODs, and even the admin. I've been camping in the bilik gerakan of my hospital, COVID-19 hospital, for the past I would say 9 months. I can see that every single one of us is actually working very, very hard. But unfortunately, what happened is actually every single level of us cannot appreciate what people's dad is doing. The junior one thinks that the senior is not doing any job. The senior think that the administrator that is not doing the job. The administrator think the junior or the seniors is not doing it. Everyone is actually having a fractured communication. That's the main problem that we have in the COVID-19 pandemic right now. So these are the difference between burnout and stress. When we are talking about burnout, I would say that the way that we show it, the effect that a person that is burnt out shows is just like this. Can you see my face? My effect is restricted. I'm not showing any kind of emotion. I talk in a monotonous way. I'm not interested with all of you. I just see there and see there. I just run my eyes everywhere. So I feel distant, and you feel distant with me. That is burnout. But when we are talking about stress, we are talking about people like that kind of things, you know. Feel overwhelmed. I am not able to rest. I feel edgy. I feel irritated. I feel I don't have the energy to do things, and I'm anxious, because stress actually leads us to have anxiety disorder. Burnout usually leads us to have depression. That's a different thing, you see, because burnout, as I tell you, it's actually an interpersonal issues. So interpersonal issues usually involve emotion, while stress is actually more of a issue with our own self. So what can be done? What can be done? I need to check my time. Okay, I have 9 minutes. What can be done in this situation actually? Of course, it's actually quite easy for me to just put a slide here and everyone can read it. And I'm not sure whether it works for you or not, but there are a few suggestions that I can give to you, because I am not able to really gauge what's actually the context that you have, the perspective that you have. But these are the, I would say, the common things that usually we will discuss with our client when they come to us. And I actually adapted this hexagram from acceptance and commitment therapy. That's actually done for one of the psychotherapy that we are doing for many psychiatric problems, including emotional issues. But number one that we need to do is actually to accept the fact that there is lots of things actually just beyond us. We need to accept lots of things that's actually just beyond us. Not to say that we are stop to fight. We are not fighting anymore. But we need to accept that there are few things that just beyond us, and we cannot control everything. We cannot control everything, even though we are idealists. That's the first thing that we need to remember. And the second one is actually when we are able to accept things that we cannot control, we must be able to accept things in hand. Because most of us are so worried about something that is not beyond us, and they forget about things in their hands. So the second step of acceptance is actually to be able to accept what is in your hand. What is in your hand now is actually, number one, is the passion that you have. Number two, the age that you have. Number three, maybe the family that you have. Number four, maybe the loved one. Number five, maybe your colleagues. So all these things you must accept dearly, wholeheartedly, before you are talking about something that you are not able to control. There are two different points of acceptance. Number one is actually accepting the fact that there are lots of things in this world that we cannot control. Number two is actually accepting things that we have and use it to our strength. That's the most important thing. So if you notice here, there's actually 6 different tips that we can share. Obviously, I cannot share everything here now, but I can share a few things. The second one is actually what can be done when we are alone. Of course, people are talking about me time here, me time there. You need to have your me time. You need to go somewhere. You need to go vacation. You need to pergi Langkawi. You need to go Penang. You need to go Sabah. to enjoy yourself, everything. But actually, me time is not as complicated as that, because me time can be done even when you are sitting watching the CME. Sitting watching the CME can be done as a me time for you, because me time is actually doing something that's just actually outside of what you are routinely doing. That's the thing of what is the meaning of me time. So whatever that you do that is actually not your routine is considered something that can be done as your me time. What I would like to share what I'm doing. My me time is actually because I'm traveling from Sungai Petani to Alusa every day. So what I do is actually when I'm driving in my car, I use that as my me time. I ruminate a lot, I reflect things, and then I find things for me to feel much better once I reach my home or once I go to work. So that's my me time. Of course, all of you can do whatever that you want to do, but me time is very important. So what are the things that we can do? This is what we call the mindfulness toolbox. I cannot teach you everything, but I will just pick up few things. Savoring and appreciating friendship. When we are talking about burnout, it's about interpersonal issues. When we are talking about burnout, we are talking about interpersonal issues. So savoring and appreciating things with your friends, with your loved ones is very important. This is the time for us to connect to people that we think is important, including all of our colleagues. As I mentioned earlier, we are all in the same ship of COVID-19. We are actually in the same situation. So we must savor this and appreciate every single one of us around us, including our paramedics. I would say that when we are good with our paramedics, it will do wonders to our job. I have my own experience with this, not something hanky-panky. It's very real, and I like to work with my paramedics. And then other things, actually engaging. Engaging means that because when we are burnt out, we are disengaged with the reality. So one of the things that we need to do is actually to engage with the reality in hand, what we are facing every day. Engage with that, work with that properly, work with that as a team, not as a person, because you cannot fight burnout single-handedly. You need to have friends to do this together. And number 3 is actually acknowledging thoughts and feelings. Because some of us are afraid of negative emotion. Some of us are afraid of negative thoughts. Some of us are afraid of negative psychology, because people say that we need to be positive 24 hours a day, 365 days a year, which is actually absolute delusion. Because we are human and we have negative emotion, and negative emotion is normal, and it comes, it goes, it comes, it goes, and no one is actually kebal from it. You see, no one is invisible from it. So we must acknowledge that there are times will not be okay, but it's okay for us to not be okay, as long as we know that we will move forward. Not move on, different, move on different, move forward different. I'm talking about moving forward for yourself, not for others, for yourself. And if you're talking for others, it's actually about your loved one, the one that you really care. So what's next? We classified things that we know is actually things that we do every day that towards our value, because we as a person, we have our own value. I can share my value. My value is actually resilient. That's why in my WhatsApp status, I put resilient as the words there. So my value is actually resilience. So I always check whatever that I do, whether it's actually towards my value, resilient or not. If I do something that's actually not towards my value, I will try to lower it down, or I will try to leave it. I would just focus on things that I would say that I will enjoy this. So I always work towards my value. These are the things that we can do. Simple things, but it can work a lot for many of you. And it must be workable. So what's next? Thank you so much for having me today. I have 2 minutes extra. Very good. Okay, I think we can proceed to the question and answer after this. Thank you.
Thank you so much, Rostam, for that wonderful talk. I will always remember 3 things. Are you okay? Always ask, are you okay? Smile and say thank you. That was stuck in my mind quite clearly. So can I pass the mic to Dr. Iskandar Mirza to handle some question and answer?
Okay, thank you very much, Dr. Rafida. Okay, it's a very good talk, Dr. Rostam, very good. Okay, before we start asking questions from the audience, I would like to ask my first question from me. Dr. Rostam, because I takut I the one who also affected by this problem. What is just a summary, Dr. Rostam? What is personality type A, B, and C? That's all
Okay.
from me.
Okay. When we are talking about personality in psychiatry, right, we are talking about cluster A, cluster B, and cluster C. So I will just highlight cluster A, B, C. I will just highlight cluster C and A because B usually we are not having problems with that. Because B usually we are talking about histrionic, dramatic kind of personality. Other people see as a problem, but they are not really problematic. They have problems with their personality, but they are okay and they need help. So in terms of A, it's actually people that among our colleagues also, we have lots of this kind of personality. They are very timid. They talk very limited, and they don't know how to really socialize people, and they can be very awkward with social situation. This is the typical type A personality. While the type C personality is actually more of the anxious type, avoidance type. There are a few that I see, I've met before, our colleagues that having problem with the avoidance personality, in which this client is actually avoiding everything that being given to them. So as a doctor, that can be very difficult. But there are person with this kind of personality. They are not having mental illness. They just have a personality that cannot be given any kind of responsibility. And of course, in our situation, it cannot be done like that, right? So that's what I can share with you.
Okay, thank you, Dr. Rostam. Okay, the first question will be from Jahiza. The question is, why is the problem of burnout is so rampant in Malaysia, despite many reminders, efforts to improve on it, etc.
Okay, I think it is Dr. Jahiza, I think, anesthetist, consultant anesthetist. Yes. Okay, burnout is actually not something unique in Malaysia. Burnout is not something unique in Malaysia. I've done a very, I would say, that anecdotal observation on Google platform few years back among the junior specialists in Malaysia, and I found out that actually around 50 to 60% of junior specialists is also having symptoms of burnout, and it's actually the same like other countries all over the world. And obviously, as I told you in my talk just now, in this situation, the perspective is totally messed up. The situation that we have now is actually messed up with lots of things. We have issues that still not yet able to really settle, which is actually our young doctors issues. And then we come with the pandemic issues. We come with the supply. We come with the SOPs. We come with the CACs, and all those things actually messing things up. And that's why I think most of us is actually really venting out in the social media, because as I told you, in this situation, most of us feel that we are not appreciated. Most of us feel that we are working in silo, and most of us feel that no one is listening to us. That's why we can see that lots of complaints in the social media, and it's actually become sensationalized worse. Even though there are lots of things that can be settled in-house. Okay, that's my answer.
Okay, thank you, Dr. Sam. The question also will be from Dr. Afida, our own MedTweet team. I had a junior call me and say, "Kakak, I can't work like this anymore. I will either kill myself or otherwise kill someone." The first instant, I would say you need a psych assistant. But he actually thought about that earlier on, but he was worried of the implications. So the first question would be, what is the implication if a doctor gets a psychiatric evaluation, diagnosis like depression or anxiety? Will it affect his or her future job application? Can they keep a secret from the department? These are the first questions, Dr. Rostam.
Okay, first and foremost, your life is more important than anything else in the world. Your life is more important than anything else in the world. Number two, for you to be okay, for you to be able to work properly, you need to be okay. And for you to be okay, you need to be treated properly. You need to go through a therapy properly if you need medication, and you need to take your medication properly. I would say that there's lots of stigma of seeing us, the psychiatrists. Even there's lots of joke about us also in the past. And I think that that stigma, the self-stigma that you have, is actually stopping you from really getting help. So in terms of searching for help in the hospital, it's quite easy. In the government hospital, it's very easy, in which you can actually can call us in a direct line to our phone and ask us for appointment. Usually some hospital will do walk-in for housemen, walk-in for doctors and everyone. And it's actually quite easy to talk to us. And most of the time, there will no other people in the hospital that will know about your issue, except when you get an MC from us. Except when you get MC from us. And when you come to us, when you are registered under us, the file of your file will be classified in different kind of secret act, because you must remember that for psychiatric patient, for psychiatric client, we have a different mental health act compared with other clients in the hospital. So we are actually protected in different kind of law. So that's why every single file of our doctors, the young doctors, is actually not supposed to be able to be accessed by any other doctors, including their HODs, including their colleagues, because it's actually restricted only for psychiatric doctors. If you are using computer system, and it's actually better if you are your hospital is still using the file. Okay, that's number sir. Okay, next one is actually when I said if you need MC, of course your HOD need to know that. You need to pass the MC. That's actually your responsibility. But as I said, the most important thing is actually for you to be okay. It's not worth you try to fight on your own till the point in which you think that dying is better. Not worth it, because your life is so precious for everyone that loves you. That's the most important thing. And for you to work properly, you need to be better. So most of the time, when you get the proper treatment with us, you will be okay, you can work properly, and you don't have any problem. The problem with many of our client in the past is not actually having MC with psychiatry. The problem is actually they are not able to function as a doctor in the departments. That's the problem that caused them to be extended, that caused them to get penalized by their HODs and other kind of penalties in the department. Not because they are getting MC from the psychiatry, or not because of they are seeing us, the psychiatrists. Because some, not many, not all, some of our government servant use us as the platform for them to get long MCs, because we are a few departments that can give really long MCs. But usually I will say that the maximum that we give in one point of time is actually 2 weeks. And then we can see you almost every week or 2 weeks, depends on the needs of you. Okay, Iskandar.
Now we go to the second question, Dr. Rostam, from the same person, Dr. Afida. What is the best way for the doctor to seek help through the HOD, or is there any assurance that it will not affect their daily job? Get a private psychiatric consult, or there is a pathway for doctors to get early help in the hospital?
Okay, if let's say in HKL, we have a specialized unit, what we call a skin Socorro unit. I think Temerloh also has this skin Socorro unit. There are a few hospitals in Malaysia that has the skin Socorro unit, in which they cater for housemen and the junior doctors. That's number one. That's the first unit. If you are working in this kind of hospital, that is the first place that you can go. Number two, if possible, try not to come to us when your HOD refer you to us. Come earlier, before you are burnt out, before you are not able to the point of not able to work. Please come to us early, because early, as if we can treat you early, you can become better early, and no one will know that you are having problem, because none of us has diagnosis on their forehead. I don't think that all of you knows that I'm having depression. You know? No, right? No, I'm not having depression actually. Just saying. Okay, so that's the situation. Okay, so yes, of course, if let's say you can get a private psychiatrist, it's up to you. But the problem, if let's say you need MC, then the problem will come there. You need to come to us for us to really go through you again, and we need to issue different kind of MC and different kind of appointments, because you are still houseman. So that's the problem. But if let's say you think that you don't need any MC, you just want to see your doctors in private settings on your own time, it's up to you, no problem.
Okay, thank you, Dr. Rostam. Next question is from Dr. Shazwin. May I know how burnout is differentiated from mental illness in the first place, or is it closely interlinked?
Okay, burnout under ICD-11 is not considered an illness. Burnout not even a symptom. It is actually classified under occupational phenomenon. Occupational phenomenon under ICD-11. That's actually the first time burnout comes into ICD. Before this, there's lots of debates about how to define burnout, but in ICD-11, we have it inside the ICD-11, but it's actually not under psychiatry. It is actually labeled as occupational phenomenon, and that's why burnout is supposed to be seen by our OSH team, OSHA. But of course, in this situation, our OSH team also overwhelmed with lots of other jobs in the hospital. So we are okay to see all these patients. Having said that, at the same time, of course, the symptoms of burnout sometimes mimics other psychiatric problems, including depression, anxiety, and everything. And that's actually our job to really differentiate whether you are actually having this kind of occupational phenomenon, which is burnout, or you're having stress, or you're having a subclinical psychiatric problems, or a clinical psychiatric problems that need to be treated properly.
Okay, thank you. Now the next question would be from Dr. Ernest. But if the hospital, the WHO applies to find out that they have psychiatric diagnosis, will it in any way affect their job application?
We are not supposed to find out any kind of medical illness of other people. And it's actually not the job of the administrator to find your psychiatric diagnosis, even though let's say you have been seeing your psychiatrist for 5 years, 10 years, as long as you can do your job properly. Some of us will say that, oh, I cannot do my job because I have illness. What kind of illness that you have? Psychiatric illness. And of course, your HOD wants to know what actually you are having. In that situation, you need to you are obligated to help your HOD to know what's actually your problem in that situation. However, in other different situations, you are not supposed to tell them. There is no need for you to tell them, except it's actually compulsory under any kind of law.
Okay. Another question from Dr. Andy. How to achieve psychological flexibility when they are indulged in the past bad or traumatic experience? Oh, quite good question.
Ini 1 hour punya jawapan ni jenuh. Okay. Psychological flexibility is actually the G's of psychological flexibility is actually 2. Number 1 is accepting, as I tell you already, accepting the things that we are not able to control and accepting the things that are actually in our hand. And the second component of flexibility is actually the commitment towards the future. That's why I'm talking about moving forward. Moving forward is it's actually different from moving on. When we are talking about moving on, people are saying that we need to forget certain things. But moving forward is actually you are moving together with your past as the new strength, not your weakness. That's the difference. So I just give a very broad answer because this is actually one whole lecture for that. So I hope it helped our friend there.
Okay. Next question will be from Dr. Anis. Doctor, what is resilience truly means and how to cultivate this value?
Okay, resilience dalam bahasa Melayu, dalam bahasa istilah keliotan. Resilience is keliotan, liat, flexible. So means that you can fall down and you are able to bangun balik and fall and wake up and fall and wake up. That's actually keliotan or resilience. The ability for you to really walk even though you fall 100 times. That kind of resilience that we can, that is the thing that we want to really have. But of course, actually not something that everyone has, but actually it can be trained. And number 1 that we need to do is actually the awareness of our psychology, the awareness of our emotion, the awareness of our thoughts. That's something that we can learn from day 1. How we want to do it? Simple. Let's say you have a situation this morning that caused you to show a certain emotion. What you can do is actually reflect to the situation, and then you see it in a different perspective. And then when you use a different perspective, you name what is the emotion when you use a different perspective. Let's say your emotion for that situation is anger. And in a reflection, you do a second perspective and you said, if I use this perspective, I'm not anger, it's actually I'm more of annoyed. And the third perspective, maybe I feel sympathy or empathy towards whoever that get my anger. Or number 4, the perspective is different. So that is the way of us to teach this kind of psychological flexibility and also resilient. That's one of the steps lah. Huh? Okay.
Okay. Now, next question from Dr. Nurkai. Doctor, do you have any tips on how do we identify and determine our values?
Oh. Okay, how to determine our values? Very simple. What is your passion? I ask you, what is your passion? Some people will say my passion is actually hard work. Some people will say my passion is teaching. Some people might say my passion is love. My value is love, or whatever it is. Name what is actually your passion with, or name what's actually the value in life that you really cherish. Like gratitude. Some people said my value is gratitude. So they are talking about gratitude every day. They see small things, they feel positive with all small things. They are not affected by negative small things or big things. So that's one of the value that we can learn. So it's actually very flexible. It's up to you. You need to know who you are.
Okay. I think this will be the last question. It's very interesting question. Just wondering, from Ines, Dr. Ines, just wondering, what will a psychiatrist do when they get burnout?
We have our own therapies. Okay? If let's say Dr. Rostam is having problems, I will see my colleagues. So my colleagues, if let's say they are having burnout, they will see me. That's actually one of how we do it. We have been practicing this since our master years. So we are very comfortable with this kind of approach in which we help each other in this way. So yeah, membawang in psychiatry is actually quite norm. So everywhere can membawang.
Okay, I think that's all for today. I will pass the floor to Dr. Hafsah. Thank you very much, Dr. Rostam, for answering all the questions.
I'll take over first.
Okay.
Yeah. So why is it, Rostam, if I have problem, you don't want to see me? So
takut dengan consultant.
never mind. So just one question I had, which is a bit practical. Somebody asked about PFA. I know PFA is available, kan? It's just that some people are, how do you make sure that everybody knows? Some people know, some people don't know. I see. So kenapa macam tu? Is it not the same throughout the country or something?
Okay. Supposedly, every single psychiatric department in Malaysia should do PFA for their hospital. Supposedly, all departments of psychiatry in Malaysia should do PFA for their hospital, and including the cluster hospital of their hospital. For my hospital, Sultan Bahia Al-Star, we are covering Jitra and also Hospital Konerang. So we are doing PFA for our colleagues in Jitra and also our colleagues in Konerang. But now we are more focusing on Konerang because Konerang is our PKRC in Kedah. So PFA in the hospital, I can only share my experience in Sultan Bahia. What we do is actually the first wave of PFA we do for everyone. Every single staff in Hospital Surabaya is actually need to go through PFA, regardless whether they have problems or not, whether they think that their psychological well-being is actually 100% okay, they still need to come to us and they can say whatever they want to say. That's the first wave. And then we have the second, the third, and now it's actually we are in the fourth wave, in which we are catering specific departments in our hospital. Number one is our anesthetic department. Number two is actually our clinic sejahtera, and then transfusion, a few departments that we cater actually, and now it's actually more specific and more targeted. And this is actually based on how our administrator tell us, because in my hospital, what we do for the PFA, I'm the one who is actually part of the bilik gerakan members, so I know what's actually happening in the bilik gerakan every day. So that's why we can really do a good PFA for our staff. So if let's say your hospital is not doing the PFA or you are not aware of the PFA, contact their HOD, ask them about the PFA, because every single one of us in Psychiatry Department Malaysia is actually able to do that. Okay. So if let's say you are in the district, the PFA is actually under the MHPSS of the states, means that it's actually under the public health. But sometimes they will ask us to help them, including the FMS. So different hospital has a different team. The PKDs has a different team.
Okay, I think that's good. At least they will be aware. Okay, yeah. I think we'll probably wrap up. I think it has been excellent, and of course, I would like to thank the other two guests as well, Ashraf and Halim, for joining us. And maybe your last few concluding remarks, Rostam.
If you don't mind,
okay.
Dr. Rostam,
Guys,
can you please tell us, in conclusion, how do we recognize burnout? How does the person who think that they are experiencing burnout manage that situation? And how do people respond to people who may have burnout? So 3 questions.
Okay. Okay, number 1, awareness is very important. Awareness is very important. Number 2 is actually you need to accept that you are vulnerable. That's number 2. Some of us think that they are too strong to be having symptoms of psychological problems. So awareness. Number 2, accept that you are vulnerable too. Number 3, seek help from the nearest person to you. How to do it? Talk to them. As a friend, you must be able to listen without judge, number 1. Number 2, listen without any comments. Number 3, listen without any advice except when your friend asks for a specific advice. That are the things that you can do as a friend. So as a person, awareness, accept the fact that you are vulnerable, seek help, take charge of yourself, be responsible, and we can do this together.
Thank you, Dr. Rostam. That was excellent. And I cannot, describe how helpful the points that you've brought forward to us, how helpful it is in dealing with burnout in the future, whether it's from the person who's experienced the burnout or the person who are actually having a friend or a colleague with burnout. So I think, I hope from this session, actually, people are able to recognize it and know how to manage it when they experience burnout, and know how to respond to people who may have burnout in the future. We don't want to talk about rhetorics, it's all about how to solve the problem and moving forward, not moving on, hopefully, but moving forward, as Dr. Rostam said. And I really appreciate the perspectives shared by our junior doctors. Thank you so much, Dr. Halim and Dr. Ashraf. It's really helpful to have these perspectives, because we want to identify the problem in order to solve it. If we don't know what the problem is, we won't be able to collectively share our effort to provide solutions. And what I would say, my message to all of you is that, this is a difficult phase in our life with the pandemic. Medical job is really very demanding, and on top of it, we have the pandemic. So it is very important to take care of ourselves, okay? And to recognize when you're not coping and get help. Because sometimes you leave it too late and things get worse. So do take care of ourselves, and do reach for help if you think you are in problem. All right. I think, unfortunately, we have very limited time, and we're going to finish our session for tonight. If there are demands and suggestions on similar topic or relevant topics about burnout, depression, and I think today we're focusing on burnout, but there are a lot of issues that may be affecting the prevalence of burnout, or the situations, other situations that could have been dissected, in this session, but because we have very limited time, there are other issues, we have to compartmentalize and maybe discuss in a different session. For example, the issues about contract, MO, and the issues about career progression. Unfortunately, I think we do have to compartmentalize things, because if we add it and mix it up all together, we might not go anywhere, if you agree with me. So I'll finish the session, but before that, I would like to remind everyone that the next week's session will be on the topic Basic Interpretation of Renal Profile by none other than our own nephrologist, called Dr. Rafidah Abdullah. And we also have a special contest for this session. So stay tuned. Look at our social media platforms on Twitter, Facebook, Instagram. So not only that we have CME, but we also have contests and prizes to be won. So this is rather exciting. Dr. Rafidah, thank you for sponsoring those prizes. I'm sure everyone is excited to join the CME next weekend, the same time, and we'll be updating the details soon on our social media platforms. Thank you so much to everyone. Thank you thank you to the speaker, to guests, participants. I hope you all stay safe and look after yourself. And I bid you goodbye for tonight. Assalamualaikum. We'll see you next weekend.